Hello everyone, welcome back to Community Medicine Insight. In today's lecture, we will discuss radiation hazards. By the end of this lecture, you will understand the types of radiations, what are the sources of various radiation, what can be the biological effects of radiation in acute and chronic form, and what are the various measures by which we can prevent the radiation hazards. We'll start with the definition of radiation. Radiation as the emission and transmission of energy through a space or a material medium in the form of electromagnetic waves or the particulate matter. The radiation is broadly classified into two categories, ionizing and non-ionizing radiations. Depending upon the ability to penetrate the tissue, deposits its energy and cause destruction of the tissue. Ionizing radiations include X-rays, gamma rays, alpha and the beta particles. So, X-rays and gamma rays constitute electromagnetic radiation. And alpha and beta particle constitute corpuscular radiation. The examples of non-ionizing radiations includes radio waves, microwaves, infrared, visible light and the ultraviolet rays. This figure shows the complete electromagnetic spectrum, and as we move from non-ionizing to ionizing, the energy increases and the wavelength decreases. The examples we have already seen in the previous slides. We will see some difference between ionizing and non-ionizing radiations. So, ionizing radiation is a high energy radiation that can cause the ionization of atoms and molecules, and they have a high penetrating power. Therefore, they can cause the DNA damage, mutation, cancer and the radiation sickness. While non-ionizing radiation is a low energy radiation, it does not cause ionization and it has a low penetration, and it can usually cause thermal effects or minor biological effects. Examples we have seen like the ionizing radiations include X-rays, gamma, alpha particles, beta particles and the neutron, and these are the examples of non-ionizing radiation. The common sources of ionizing radiations include the nuclear reactors, radioactive materials and the man-made sources like X-ray machines. While the non-ionizing radiations, the common sources include mobile phones, microwave ovens, radio transmitters, sunlight and the electrical appliances. Since ionizing radiations can cause DNA damage, they are responsible for the causation of cancer, genetic mutations, radiation burns and bone marrow suppression. Although the non-ionizing radiations cannot penetrate deeper into the tissue, they can cause tissue heating, cataract and skin burns. The ionizing radiations are being used in the medical imaging in the form of X-rays and CT scan, in the cancer radiotherapy and the sterilization of the medical equipment. The radio waves are used in the communication system, microwave in the cooking, and we are using infrared in the physiotherapy. Here the penetration power. The gamma and X-ray, they have a more penetrating power than the beta particles, and which is more than the alpha particles. The sources of radiation can be natural sources or the man-made sources. The different natural sources are cosmic rays, radon, terrestrial radiations and the internal radiation. Cosmic rays include the radiations which is coming from the outer space. and the exposure increases at the higher altitude. Radon gas is produced from the decay of uranium in the soil. Terrestrial radiation is the radiations which is naturally occurring in the radioactive material in the soil, rocks, and building material. A small amount of radioactive element is also present in the human body through food and water. The example include K40, C14. Coming to the man-made sources, the medical exposure through X-ray, CT, radiotherapy includes a largest artificial source. Other sources can be the nuclear industry, fallout from the nuclear testing, and the occupational exposure. The radioactivity of a material is measured in Becquerel, that measures how much radioactive material is present and it doesn't tell about how much harm it can cause, and the older unit was Curie. The absorbed dose is measured by Gray, and that measures how much radiation energy is absorbed by body tissues. And earlier it was measured by Rad, that is a older unit. Sievert measures the biological harmful effects of radiation. So it tells how dangerous that radiation is for the human body, and the old unit was REM. So the activity is measured by Becquerel. The amount of radiation which is being absorbed by the body is measured by unit Gray, and the biological harmful effects of radiation is measured by Sievert. Radiation causes damage to the tissue by the ionization of water molecules, leading to the DNA damage, mutations, and the cell deaths. And the severity will depend upon the amount of radiation received, the duration of exposure, the type of radiation, and the radiosensitivity of the tissue which is being exposed. Highly radiosensitive tissue includes the cells which are rapidly dividing, like bone marrow, gonads, intestinal epithelium, embryonic tissue, and the lymphoid tissue. Comparatively radio-resistant tissue includes the muscle, nerves, mature bone. The effects of radiation can be short-term or acute effect or chronic effect. So short-term effects occur after exposure to a high dose of radiation over a short period of time, and they are also called deterministic effect. So there are two types of effects, deterministic and stochastic. Here the term is deterministic. Deterministic effects are those which occur above a threshold dose and the severity increases with the dose. When the whole body is exposed to the high amount of radiation within a short span of time, there occurs the acute radiation syndrome or the radiation sickness. What happens in acute radiation syndrome? There are 4 stages. First is a prodromal stage, which occurs within hours to 2 days. There occur symptoms of diarrhea, nausea, vomiting. At prodromal stage, we have a latent stage in which the person appears apparently healthy. After that, we have a manifest illness stage where the symptoms appear depending upon the dose. After manifest or illness stage, we have a recovery or death, and the chances of recovery decreases as the dose of radiation increases. So three kind of syndromes can be seen depending upon the dose. Initially, we have a bone marrow syndrome or hematopoietic syndrome, in which there is a bone marrow suppression, as a result of which we have a low WBC and platelet count, increased infection, bleeding tendency, and here recovery is possible with adequate treatment. As the dose increases, the GI syndrome can be seen. There is severe diarrhea, dehydration, electrolyte imbalance, and in this the death may occur within 1 to 2 weeks. In CNS syndrome, there is confusion, seizures, coma, cardiovascular collapse, brain edema, and here the death may occur in 24 to 48 hours. Radiation exposure can cause skin effects like erythema, skin burns, ulceration, and hair loss. If particular organ is exposed, like eye, it can lead to the cataract formation. If the gonads are exposed, it may lead to the temporary or permanent sterility. There is a sperm count reduction. In females, there is loss of egg. Chronic or late effects, they appear after months to years. They can be either somatic effects or the genetic effects. In somatic, we have cancers, different type of cancers like leukemia, thyroid, breast or lung cancer. It can cause cataract or the infertility. In genetic effects, it can lead to the chromosomal mutation or the gene mutation that can lead to the various congenital abnormalities or the hereditary disorders. So the chronic effects can be either deterministic effects, which we have read earlier, or it can be stochastic effect. Stochastic effect are those effects which have no threshold. So a small dose also carries some risk, and the probability of occurrence of disease that rises with the dose. So in deterministic, we have read that there is a threshold, and after that threshold, the severity increases with the dose. In stochastic, there is a no threshold, the probability of occurrence increases with the dose. So here we are talking about probability. In deterministic, we are talking about severity. Radiation can cause damage to the germ cells, and that can lead to the mutation which can be passed on to the future generations. The developing embryo is highly sensitive to the radiation exposure, and the possible outcome include the growth retardation, congenital malformations, microcephaly, mental retardation, and the increased risk of the childhood cancer. The most sensitive period is between 8 to 15 weeks of gestation. So this table shows the effect of radiation exposure at various gestational periods. As per the AERB, the occupational exposure dose limit is 20 millisievert per year, average over 5 years, or maximum 30 millisievert in any 1 year. This means that the radiation exposure of a worker is not just over a year, but over a block of 5 years. We will understand this with this example. So we have a worker who is being exposed to the radiation in year 1 by 25 millisievert, in second year exposed by 18 millisievert, in third year exposed by 22, in fourth it is being exposed by 20, and in fifth the worker is exposed to 15 millisievert. So if we take the average of these 5 years by adding, it will come around 20 millisievert, adding up it and dividing by 5. So it is average over 5 years, and in particular year it is not exceeding 30 millisievert, so it is under the safe occupational limit. For general public, it is 1 millisievert per year. Now we will see various measures which are taken for the prevention of radiation hazards. For this, we must remember the LRA principle, and the full form of LRA is as low as reasonably achievable. This is very important, comes in MCQ. It takes three things into consideration. One is time, second is distance, third is shielding. So, time, we have to minimize the time of exposure to radiation to decrease its hazard. In distance, we have to increase the distance from the radiation source so that its effects can be minimized. In shielding, we have to use protective barriers like lead walls, lead aprons and the lead glasses, and the thickness of lead apron should be of minimum 0.5 mm. We will see preventive measures under three broad categories. One is the patient protection from the radiation, second is the protection of various health workers, and third is the what are the various administrative measures. For the patient radiation safety measures, we have to avoid any unjustified diagnostic radiation exposure, apply LRA principle which we have understood in the previous slide, always prefer the non-ionizing investigations like ultrasound or MRI wherever possible. Usually the X-rays are not prescribed in the pregnant women, and for pediatric patients as well, we have to exercise extra caution and we have to ensure the clinical justification for every radiological investigation which we are writing to the patient. In occupational radiation safety measures, we have to do the pre-employment examination, and even after employment, we have to do screening at regular intervals. Monitoring of the individual radiation exposure is done using various kind of dosimeters, and there is a mandatory use of protective equipments like lead apron, thyroid shield, lead protective wear while working in the radiation department. What can be done in the administrative and engineering measures? Lead shielding of the walls, doors and equipment, display of the standard radiation hazard sign in the department, controlled access to the radiation areas, and the training and sensitization of staff is also very important. Monitoring and the documentation of exposure dose is also done, and the regular inspection, maintenance and the calibration of machines are being done. The radiation protection agencies include WHO, International Commission on Radiological Protection, and the AERB, that is Atomic Energy Regulatory Board in India, which is a regulatory body which oversees the nuclear and the radiation safety in India.